Hi, my name is Mike Hayton. I'm an orthopaedic consultant with a special interest in hand, wrist and elbow. And today I'd like to talk to you about that common condition, tennis elbow. Well, it's almost everybody I know over the age of 50 at some stage has had tennis elbow. Pain is well localised to the outside of the elbow and is made worse with lifting or cocking the wrist back against resistance. Surprisingly, it's actually quite uncommon in tennis players. Sandra here is going to show them exactly where the site of pain is. It's on the outside of the elbow around this little bony area, and patients are very specific in where this pain is, and they will tell you that pain is made worse when the wrist is cocked back, such as carrying heavy objects. Provocation manoeuvres include asking the patient to hold their wrist back against resistance while I try and pull it forward. So hold your hand there and don't let me pull it forwards. I look at the patient's face to see if the corner of their eye starts to scrunch, telling me they're in discomfort. And as soon as I notice that, I will stop. Occasionally we'll investigate patients with a plain x-ray just to ensure that there isn't underlying arthritis. MRI scans can show tennis elbow very clearly, but sometimes they're not required. Ultrasound scan, again, can show the abnormality reasonably well. However, the vast majority of patients with a good story of tennis elbow don't require any investigations. There are a number of treatments available, and the vast majority of tennis elbow will settle without any intervention from a surgeon whatsoever. Activity avoidance is probably the best thing you can help yourself with. A chartered physiotherapist can help with tennis elbow, and there's a variety of non-invasive techniques, including lasers, deep friction, acupuncture. Shockwave therapy has also been recently introduced, but we're still awaiting long-term randomised controlled trials, which are the state-of-the-art testing of a new technique. Corticosteroid injections are still a very widely, and in fact probably the most widely used injection technique to treat tennis elbow. There are risks associated with steroid injection, and it's important that the surgeon uses a relatively low dose of steroid because patients can have what we call lipodystrophy, where the underlying fat tissues are dissolved and a hollowing can occur. Increased or decreased pigmentation can also occur. And that's why some surgeons have gone away from using steroid injections. And in fact, there's evidence that just sticking a needle into the area can cause inflammation and the healing process and the healing cascade to occur. More modern treatments include injections of platelet-rich plasma, and in this case, your normal blood is taken off you, is spun down, and then platelet-rich plasma is re-injected at the site of the pathology. Well, what is the pathology? Well, we're really quite unsure. Specimens have been sent to the laboratory and don't show any inflammatory cells, and really we're at a loss of exactly why this occurs. We think it may be some misbalance between the muscles on the front of the forearm and on the back of the forearm, and this is where a physical therapist or a chartered physiotherapist can help try and readdress these muscle imbalances. If these measures fail, surgery can often prove to be very beneficial. The surgery involves releasing the muscles on the outer part of the elbow. I perform this under local anaesthetic, but more commonly it's performed under general anaesthetic. Having removed the muscles off the outer side of the bone, I tend to roughen up the outer cortex of the bone to allow the muscles now to stick back with new scar tissue. I've recently looked at my results and I'm quoting over 85% success rate with this particular surgery. But of course there are risks associated with any surgery, and these would include infection and failure to improve your symptoms. Some surgeons perform this arthroscopically, and this would involve passing a camera inside the elbow joint and looking at these muscles from the inside and releasing them from the bone. Again, there's still work needed to be done to prove whether this is better than the tried and tested technique from the open surgery. Generally speaking, the vast majority of patients with tennis elbow will resolve without any intervention from a surgeon, as mentioned, but those who do come to a surgeon can usually have a reasonable chance of some success.